Welcome top news today.
The healthcare.gov website. The Centers for Medicare and Medicaid Services is exploring guidance to exempt more people from the Affordable Care Act's individual mandate. Associated Press. The Trump administration is exploring ways to excuse more Americans from the requirement that they prove they're insured in the remaining months before the Affordable Care Act's individual mandate is laid to rest. The Centers for Medicare and Medicaid Services is working on guidance expanding the hardship exemptions from the 2010 health care laws mandate that people purchase health plans, according to two people familiar with the effort. Agency officials haven't yet finalized the guidance but aim to increase the number of reasons people could cite as justifications for not showing they're insured when they file their tax returns. The administration's expected move comes as Republicans' legislative efforts to repeal the 2010 law, known as Obamacare, and replace it with a new system has stalled. Instead, Trump administration officials are increasingly turning to executive actions and regulations to weaken the ACA, including cutting off billions in federal reimbursements insurers receive for low-income customers, shrinking the annual enrollment period and scaling back federal money to promote sign-ups under the law. Congressional Republicans and President Trump repealed the individual mandate in the tax overhaul that passed last year. But the requirement to purchase coverage doesn't end until 2019. The additional exemptions would apply to the current year, meaning they could be cited by filers preparing the 2018 taxes next year. The Health and Human Services Department, which oversees CMS, declined to comment on the guidance Wednesday. The ACA requires most Americans to buy health insurance or pay a penalty. But during the Obama administration, federal agencies defined multiple circumstances in which people could be excused from that requirement. For example, people can qualify for a hardship exemption if they experienced a serious financial difficulty such as eviction or filing for bankruptcy, or a personal difficulty such as domestic violence or the death of a family member. The current penalty for not having health coverage is $695 per adult and $347.50 per child, up to $2,085 per family, or 2.5% of family income, whichever is greater. About 6.5 million taxpayers paid a fine for being uninsured in 2015, according to the Internal Revenue Service, although the fine that year was $470 per adult. It's unclear when CMS might finalize the additional guidance. People within the agency say it is putting several items on hold until Alex Azar is likely confirmed Wednesday afternoon as HHS Secretary. Even without more hardship exemptions, it was already going to be relatively easy for Americans to duck the individual mandate this year. The IRS had already backed away from a previously planned enforcement increase, announcing in February that it would not withhold tax refunds even if filers hadn't provided information about whether they had coverage in the previous year. But the move could give Republicans additional political ammunition to make the case they have eased an unpopular requirement imposed on the American public, as they contended after passing the tax overhaul in December. Polls have regularly shown that the mandate is the least popular part of the ACA.